Hello, this is a short summary of the evidence behind and some of the methods used for classroom flipping. So here are my learning objectives for this lecture. By the end of this presentation, you should be able to contrast traditional and flipped classroom teaching, be able to construct a flipped classroom session in radiology, as well as being able to describe some of the potential challenges involved in developing flipped classroom sessions. As with all educational endeavours, however, you must remember that it is not what you teach that's important, it's what your audience learns, and I think we get more focused on the teaching often than the learning part. Before we start, just a quick reminder about active learning. Active learning is when your trainees, your students, engage in activities that promote the analysis, the synthesis, and the evaluation of class content. And in other words, so it's not about this style of teaching, but more like this. So what is a flipped classroom? So traditional methods of teaching involve the learners receiving some form of didactic teaching in the classroom setting, and they then go home and they're working on problems or they're applying their skills at the PACS workstation in the case of radiology. And Edward Schlossen said that lectures are a way of transferring the instructor's lecture notes to the students' notebooks without passing through the brains of either. And I think many of us have experienced this both in our own teaching and our own learning. So the flipped classroom takes the more passive learning component out of the classroom. The students do that on their own time, and instead the time of the instructor is spent on the application and the integration of the concepts that they've learned. This enables the instructor to be able to spend the time with the learners when they need it most, when they're solving the problems, when they're identifying the issues that they're struggling with, and so on. And classroom flipping has been applied at all levels of education, from elementary school through postgraduate, and has become pretty much the standard method of teaching at business schools. Our medical school guys are always now using this fairly extensively in the first and second year courses. So a flipped classroom has two key components. There is the self-learning component, and then there's the active teaching session. You may already be familiar with Bloom's taxonomy of learning objectives, where the lower level learning objectives, which use lower cognitive skills such as comprehension and knowledge, are those that are involved with the student's independent work, where the time of the facilitator should be utilizing the higher cognitive skills such as evaluation, synthesis, analysis, and application. So during self-learning, they may be learning facts, they may be reading about some of the background knowledge about a subject or the scientific evidence, or even just learning the techniques or the skills to apply to a problem. What kind of resources can you use for the self-learning component? The self-learning component is often provided as a video resource, but it certainly does not have to, and we'll talk about some others in a moment. So these video resources might be whiteboard videos, I'll show you in a minute, either ones that you've made or ones that are available on the web. They may be a pre-recorded personal lecture that you have made, or a web-based video or podcast, many of which are available both from national organizations and departmental websites. If you want to record your own whiteboard video, there's a number of nice apps you can use on tablets, such as Show Me or Screen Chomp, or Explain Everything, which I'm actually recording this on at the moment. And here is a short clip from a whiteboard video that I made to be able to teach the residents a specific breast ultrasound biopsy technique. Needles on the near side of us. And what we're going to do is we'll rotate the hub of the needle towards us. We'll rotate the transducer away from us, and you'll see then that our needle is now straight. This was a 2-minute video that was part of a series of pre-learning videos for a practical ultrasound guided breast biopsy workshop. Recording your own little mini lectures for the residents to use as pre-learning is extremely simple. I think the easiest way is to use a tablet with apps such as Explain Everything, which, as I said, I'm recording this on. But PowerPoint does have its own ability to record slideshows. I find this seems to work better on PowerPoint for PC than PowerPoint for Mac, however. You can also use more expensive software such as Camtasia, which obviously allows you much better editing skills than either of the last two methods. Explain Everything is pretty good for editing, however. And many institutions subscribe to something such as Echo 360, which is a web-based recording software. This is an example of a short pre-learning video that I recorded for an active learning session in Radprimer. Unfortunately, it's not that uncommon that the gadolinium dose infiltrates or is just not injected adequately to be able to get a good bolus. So the image on the left of this study here was the gadolinium enhanced image that was obtained on a patient. And when we looked at this, you can see there's virtually no contrast in the heart. We're not seeing it within the vessels of the breast. This is an inadequately enhanced study. The study was repeated a couple of days later. Now you can see gadolinium in the heart. It's going to be also shown on this clip is how you can use annotation, which is easiest to do on the iPad, but you can certainly do it with your mouse in PowerPoint to annotate the images as you go along, which just adds the interactivity of these videos. So how can you distribute these lectures? You can load them onto an institutional website or course manager. I usually just load mine up onto YouTube and then send or embed the link to give to the residents. You can load them onto Google Drive. That's small enough, send them out by email, or use a FTP emailing facility such as YouSendIt. As I said, however, the pre-learning certainly does not have to be some sort of a video resource. You might assign an article or two, or a chapter from a textbook. Radprimer also provides a very nice resource. You can assign a section or two to the residents to go through before your active learning session. And then there are multiple other online modules that are available through institutions. Many of them have ready access, such as this one from the University of Virginia. For students, we're using the core MedU courses, which are virtual patient series, as our pre-learning for multiple workshops. And I'll show you an example of those in a moment. So let's now move to the active learning session. So the time spent with the instructor is the active learning session, and this should really focus on taking the core information that they learned during the pre-learning, making sure they understand it, reinforcing, getting them to synthesize more complex hypotheses from this, applying it to different patient scenarios, and also incorporating far transfer of learning, which I'll explain. What the active learning session should not be is just another didactic lecture. So this should not be, classroom flipping is not an opportunity to just get 90 minutes of lecturing time out of a 60-minute teaching period. Just to quickly explain, near transfer of learning is when, for example, they might learn that this is the appearance of left upper lobe collapse, but that if they only learn this one example of left upper lobe collapse and not understand how that particular pattern has been produced by the atelectatic lung, then they are only able to recognize very similar appearing left upper lobe collapse. With far transfer of learning, which involves both a much deeper understanding of radiographic patterns as well as seeing multiple examples, just using radiology as a very specific example here, is when they're able to know that while this may be left upper lobe collapse, this is how it looks on CT and with and without contrast, this is also, and so on. And this is what they need to do in order to gain mastery and become experts in any area. So how do we start to develop our flipped classroom session? Well, first of all, you have to define your learning objectives, and these should be done using those Bloom's taxonomy adjectives that I showed you before. Next, you need to identify the higher order learning skills that you are going to use within the active learning session as opposed to the more passive pre-learning material. And then you go on to select the pedagogy or the teaching method for each of those specific learning objectives. So here's Bloom's taxonomy again, just to remind you that we want to have our active teaching session really in these upper levels of the Bloom's taxonomy. And as if you see here, each of these higher order skills has some very specific adjectives associated with it, and these can be very helpful in helping you develop and write your learning objectives for the session. So what elements can the active learning session include? Well, in radiology, we're often doing case-based teaching, and this is frequently going to be our mainstay of this session, but it doesn't have to be isolated to that. It can be a component of any session, but you should think about including some other things. So some form of question and answer, audience response pads with multiple choice questions can be worked in here, and this is obviously good practice for the ABR core and CE exams. The residents or students can work in pairs or teams doing collaborative work. This is a very powerful learning skill. There may be some lab work involved in particular areas such as physics, for example, or some kind of a problem solving technique going on at some point. And you can incorporate one of these or multiple of these within any one session, depending on how well you feel that that particular learning objective can be achieved. Active learning sessions can involve both small groups and large group learning. And I would recommend that you look at one or more of the YouTubes that Eric Mazur has up. He is a Harvard physicist, and he uses active learning techniques in extremely large groups using both audience response and collaborative learning, and has been extremely successful. So let's turn now to a couple of more specific examples of classroom flipping sessions in radiology. At Dartmouth, Hitchcock and Geisel, we have used this extensively with the medical students as well as the residents in a number of different ways. There are several of our faculty who are very interested in this, including chest, cardiac, breast, body and nuclear medicine, and we have some classroom flipping sessions spaced out in the curriculum in all of these modalities. I'm going to show you a short video in the moment of how we are doing classroom flipping with the medical students. The medical students use the MedU core series, of which I'm chief editor, as their baseline pre-learning. And then the active learning sessions involve use of an iPad in teaching, and in particular we use 2 screens as the app for this, you're going to see demonstrated. So here's an example from one of the hypercards of the pre-learning series for this particular case. And what you're about to see here is a short clip from one of the workshops which follows the students having gone through the case online in their own time. See, so you get it where you did. So can you draw the highlight for me? Yeah, so it's a little bit up. It should always be low. It should never be the same height or higher. Other signs of volume loss? Yeah, diaphragm's definitely up. Sit back and look at it. Let's get a picture. What else?
So this is up the trachea / centers a little bit inward.
Yeah.
Not sure what
Look at the osseous structures. Look at the bones. What do you notice in the bones?
Oh, the space between the ribs.
Yeah, ribs. And particularly we see this in kids because, you know, their thoracic cages are much more pliable than in adults. Various of our attendings in radiology have recorded short videos or used pre-ascribed papers or chapters as the pre-learning for residents, and then the active learning sessions might be entirely case-based, involve multiple choice questions using clickers or some combination of the above. On occasions they've required them to sit down as groups and work on a specific problem or try and analyze a case. Here's just an example of the flow from a classroom flip session I do in breast MR. They have a 20-minute video prescribed as their pre-learning. I start the session by giving them a multiple choice audience response pre-test to make sure they understood the information within that video and clarify any points. It also kind of primes their brains for learning in the rest of the session. There's a very short lecture included in this, like a 10-minute lecture, followed by a group exercise, and then they're going through cases with audience response, multiple choice questions associated with them. For the audience response, you can use clickers such as Turning Point or a web-based system such as Nearpod. I've been using the latter when I'm doing this particularly for multiple sites. It also allows me to instantly identify who the responder is to our specific question. So this is residents at Tufts who are answering my questions from a session that I'm doing at Dartmouth Hitchcock. And we've had up to 4 institutions involved in any one active learning session in this manner. For one section, the residents were asked to sit down in pairs and be able to compare and contrast the MR characteristics of benign and malignant lesions based on what they had learnt in the pre-learning session. Again, this is consolidating the information that they learnt and bringing it together. So what have we learned through our experiments of classroom flipping in radiology? This can be a great teaching method. It does foster independent learning skills as well as group learning skills. It enables them to have to collaborate with each other if you set the sessions up right. They definitely have increased intention during the sessions. They can't just sit there and eat their lunch and kind of doze off. They have to be, they're very much engaged in the session, and it does call to order their higher level learning skills rather than more passive learning skills, as well as their communication skills during sessions. I found it very helpful to identify concepts that they're having difficulty with that you wouldn't otherwise during a session and be able to clarify those problems. And it often generates new questions during the session, which you then need to branch off into, but it does give you that flexibility to explore those. Generally speaking, we've had very positive feedback from both students and residency sessions. And you see that this was a session I did with a large group of students. And, you know, they're all clearly engaged and not on the email during this. Being able to provide some of the material for them to learn offline has its advantages. It does mean that learners who have different learning curves can be accommodated. Learners of different stages, when you have first-year residents and fourth-year residents, can be accommodated. You can get that baseline framework of material in for the more junior learners before you have a somewhat higher level active learning session. And for those learners who need to go through the material maybe 2 or 3 times before they understand it rather than hearing it once in a lecture, they're able to do that. By providing this framework for novice learners, you're going to reduce the cognitive overload of your actual teaching session, and that really helps you with some of this mixed group teaching. Now, what does the research based on classroom flipping show us? It's limited, but there's more coming out all the time. Things that have been shown to be improved are attendance, some of the emotive or the motivational aspects of learning, which we should not underestimate by any means. Exam scores in some of the studies have gone up, or at least they haven't gone down. But you know, there still is a question as whether this really helps long-term learning. I can't tell you that we're going to be turning out better doctors or better radiologists because of it. The evidence is just not there. So what are some of the challenges that we've encountered? This is a big change in both teaching and learning styles for the instructors as well as the learners. Both instructors and learners are very used to the more passive didactic way of teaching, and it does take them time to adjust. Developing and implementing a new classroom flipped session can be challenging and time consuming, but very rewarding, I think. As the learners have to adapt to this different way of learning, the attendance may initially go down, and we saw this particularly in the first years doing a flipped classroom anatomy course, because they didn't want to turn up when they realized that they hadn't done the pre-learning because they would look stupid. It then increased again as they realized that if they didn't turn up, they weren't going to learn the material. So you have to kind of expect this and work with this. There can be some technical issues, particularly when you're learning how to record your own talks, for example, or deploy more multiple modality resources during an active learning session. It's not all that easy lecturing to a computer and still sounding interesting and modulating your voice and so on. When I record these, I always seem to end up with a dog barking in the background or the doorbell going off. You have to learn to be very flexible during these sessions and kind of go with the flow with where they're leading. But at the same time, you don't want to get carried away by the flood, and you need to be able to pull back the direction of your teaching where necessary. You do have to limit your learning goals for these active learning sessions. You can't possibly deliver the body of information that you're going to in a 60-minute session. But just to come back again, it's not what you're teaching, it's what are they learning, and having less information which is gone to in more depth long term is likely to be beneficial. You do need to limit the pre-learning. We've discovered that assignments really need to be under 40 minutes, probably 30 minutes is ideal. Keep videos to under 20 minutes or split them up into multiple short videos that the learners can look at individually. No more than one or at most two papers or one chapter to preview. I think particularly for the residents, they're all on different rotations. They have studying that's associated with those rotations, and so you don't want to overload them with pre-learning, particularly if there's multiple classroom flipping sessions going on. I've discovered that you need to give them notice of not less than 1 week and not more than 2 weeks, otherwise they're not going to do it for assignments. You can post this on a course manager or website. I tend to email them, and then I email them with reminders a couple of days before. And get feedback to modify your pre-learning and the subscribed sessions. You may need to reduce the amount or the difficulty of both of the sessions or adjust your timing somewhat. You also have to be careful how many of these sessions are you doing. If you are suddenly going from a pure didactic curriculum to giving 5 flipped classroom sessions a week, the residents are really not going to like you. Because that means an awful lot of pre-learning that they need to do. If they have 1 classroom flip session a week, then that's probably more reasonable. But I would like to suggest that even if your first session or 2 is not wildly successful, that you continue to persevere, because these can be very effective and stimulating ways of learning and very rewarding for the instructor. So just as a quick summary of this talk, so classroom flipping sessions require very careful planning to make them effective, but the active learning does have significant benefits. There are many different ways of implementing a classroom flipping session. I've tried to outline some of these here. And there are some real advantages when teaching to mixed learner groups. But just to be aware that there is a learning curve for both the instructors and the learners. It's not going to work for all classes, and not all students or residents enjoy this form of learning, and that doesn't necessarily mean you shouldn't do it, but just to be able to recognize that, and also that not all instructors are probably going to be able to do this, but if you're interested, it's well worth a go. Thank you for listening.